Hey everybody, we're at Las Vegas at the A4M conference, largest anti-aging conference in the world. If you want to know more about hormone replacement therapy, anti-aging, cutting-edge wellness solutions, I'm with my buddy Mike Brookins from AMI out in Santa Barbara, and we're going to have some great content for you. I'm actually in Las Vegas right now at the A4M, which is the largest anti-aging conference of the year. I'm with one of my great friends, also who owns a clinic out in Santa Barbara. I call him the West Coast Brian, but it's Michael Brookins.
West Coast meets East Coast.
Exactly. East versus West. Welcome to the show, my man.
Thank you, my friend.
Good to see you again, as always.
Good to see you. I love coming to this event.
Listen, man, we are totally nerding out all weekend talking about
it's gross.
Protocols and peptides and testosterone and the newest therapies. Listen, the first thing that I have never asked you, how did you get involved in owning the anti-aging clinic?
Well, I mean, like Brian, like we said, it's great seeing you guys here. It's one of the few times that I get to come to these events. I get to see you guys again. We get to nerd out. But I guess I got my start, and I was a nuclear medicine technologist and doing a lot of interventional endocrinology. I was an Olympic athlete, like we were all using. That's what I
was
knew.
Was it testosterone back then, or
it was testosterone? It was Winstrol. It was human growth hormone. I mean, we were human pincushion. Our strength coaches were giving it to us. Everybody was giving it to us. But my first gig as an age management consultant was with a little company. It was a forum called Steroid.com.
Oh, yeah, a little forum called Steroid.com.
Yeah, they got 20 million hits a year. I was the head moderator on that forum. Everybody went there to take, hey, what do I take with what, and all this, good stuff. The owner of that got some heat from the DEA. I had to step in and start training physicians all over the U.S. on proper integrative endocrinology.
Right.
What to do. So, and that kind of saved us butt at the end of the day. And we funneled 20 million patients into all these physician practices, around the world to do proper kind of HRT. Everybody in the world when I started trying to do hormone replacement, IV nutrition, said, you can't do it. You're not an MD. You're not a provider. And I did it anyway, and I met Brian Burke here. I'm Eric from 50 Redefined, and we're all non-provider, non-guys that non-clinicians that own our practices and do very well. So it's
great.
It's great.
It's what it is because I think for you and for me, it's both passion. It's
you gotta be passionate about it.
I was low with hormonally deficient in many different areas. I went to a clinic. I was righted, and I felt so good that I decided to start my business. And
we all have the same story. We all have the same story.
You know what I feel, and you probably feel this 1,000 times a day. When I'm talking to my clients, I was that guy on the other side of the desk. So
Absolutely.
I have empathy, right?
And I think it's great too, because it's like, when a patient comes to you with certain problems, you're like, I've been there, and you can relate. You can add your same personal stories. I had the same thing. I was an Olympic athlete. I could not compete unless I used anabolics, unless I used testosterone replacement therapy. And back then it was very demonized or dogma. But you kind of did it anyway. So you can bring that to the table when you talk to your clients, and you can relate. And it's just great. It's a great service.
It's really, I think, first of all, I remember like when I got my first package, I looked at all these little vials and needles and powder, and I'm like, it's not only what do I do, it's, will this stuff work? Yeah. There's no way that this little powder can actually be like a life changer.
And then what happened?
Oh my God, man! 35 pounds later, in 5
like 2-3
months,
weeks, you're like,
I felt immediately better.
Light bulb back on. It's like someone got the fog off the goggles.
The depression, there's no more depression.
That's the first thing I hear. Within the first 2 weeks, guys go, I'm like, well, what can I expect with testosterone therapy, ipamorelin, getting my hormones modularized? I go, well, what I hear, and I'm not going to give you the hard sell, what my patients tell me, within 2 weeks, the lifting of depression happens because you have thousands of testosterone receptors in the brain. You have this dopamine push, and the first thing you're going to feel, if you have it, is the lifting of the depression, which is, I think, great, instead of an SSRI or an antidepressant.
Listen, how many people do you think are on how many males are probably on Prozac or some type of antidepressant?
It's the most prescribed medication in the world, if that gives you any idea.
It's crazy. And it's not only that, there's also an antipsychotic that I think there's it was on the Joe Rogan podcast.
It is called Seroquel.
Like 60 or 70% of all guys that go on an antidepressant have to go on an antipsychotic.
Right. And I do this when we do gut and brain microbiome, and we test heavy metals, B vitamins, which in the villa and flora, you make 90% of your dopamine, you make 50% of your serotonin in the gut.
Right.
So why these doctors start doing these fix your wires in the brain stay away from that. Fix the gut and brain. So you focus on the gut, focus on B vitamins, D, and testosterone, all these hormone modulators. You watch people improve. Don't mess with the brain.
It's crazy. You know what I find a lot, and I'm sure that you encounter this in your own practice. Our initial consult is sort of expensive because it includes such an expansive hormone panel.
Right.
And people are used to going to their general practitioner and they get a CBC, a CMP, and like a lipid panel, which basically tell you nothing.
TSH?
Yeah.
It had nothing to do with thyroid.
Hey, by the way, it is the most insane thing. How is it that they don't run T3 and T4 when TSH?
It drives me crazy.
It's mind-boggling,
and they're like, well,
right?
oh, my thyroid's good, my T is just normal. And I talk to patients, I go, so that's a pituitary hormone.
Right.
It stands for thyroid stimulation.
Crazy.
It tells me nothing about your thyroid. And by the way, the labs your doctor just did you tells me nothing. It tells me you're standing in front of me breathing.
Right.
That's
Listen, why, because we see so many people that have normal TSH, but their T3 and T4 are so low. But why is that the standard test?
So there is a correlation. The Society of Endocrinology does state that TSH is homeostatic to T3 and T4. In my years of doing nuclear medicine, doing thyroid ablations with radioactive iodine, that's all I would get from endocrinologists. And there is some truth to it. However, when talking hormones, when talking testosterone, when talking adrenals, there's this negative feedback loops, there are these axes. It's not true for all. So it's like when someone does a genetic test and says, oh, your predispositions for this. I don't care about that.
Right.
I want to know exactly empirical data. What is my T3 doing? What is my T4 doing?
Right.
I want to know exactly. So you need to do a more expensive panel. So, and that's why it's $350, $400. I mean, a little more expensive, but it's 70 more panels. It's 10 vials, pints of blood they take out of you. It's great.
It's crazy. I always, and I try to explain it to the clients that, for insurance purposes, oftentimes insurance companies won't cover tests unless they're running a certain sequence.
Right.
So, like, if someone has
unless they
bad,
test really lower, that they'll cover it.
And then they could cover the next one, then they could cover the next one.
Yeah.
And sort of, it's very bizarre how the entire sort of insurance / labs work.
Right.
But the labs that the general practitioner run don't give them enough data, and I think they don't have enough time.
Well, and they don't, and really, and I try to educate patients on this too. It's like, I don't mean to bash MDs and doctors. They're there. Like, if you get cancer, you get hit by a bus, great. Go to your MD, do that. But if you're looking for preventative, integrative, functional medicine, like, you got to go cash pay. You got to go someone that's used to looking at the biomarkers. And really, it's really like, for instance, you go to a GP, use your insurance for the labs I'm going to do. They're $5,000 request.
Yeah, it's crazy.
They're going to charge your insurance $1,100. It's going to be a $1,200 copay. But come to us. We have the benefit that with cash pay practices, you can negotiate with the pharmacy. You can negotiate with the labs. We can pass those savings on to our patients.
Right. It's amazing. There are so many times when we first started our practice, of course, this is like 5-6 years ago, that we would try to be, helpful to our friends. And our friends would come to us and say, and, new clients, and they would say, hey, I have an amazing insurance plan. Just run the blood work through the insurance plan. And I would say, listen, I'm going to do that for you, but there's a chance that the charges aren't covered, and then we have a problem.
I know.
And then I would get a phone call, Brian, I have a $6,000 bill.
I know.
I have a $5,000 bill. What's going on? And I would then say, listen, I told you that we could run it for you at a much more reduced rate. You thought you had amazing insurance, but in general they don't want to cover anything.
I have the same exact story when I first started. It's basically the same thing, and I've graduated to saying, call your insurance companies, see what these labs are cover. In most cases, our cash pay price is much less than your copay.
Exactly.
And you know what? They always call back. They go, you're right. It was going to be $4,000 for the labs you guys run.
Well, the other thing, even with the copay, like I've done this before. Here's where I think that the whole industry of insurance and labs is bizarre. I ran our panel through my insurance, and I ran it through us, right? So I know what the cost is.
Right.
My actual insurance, I get a bill from the insurance. So I get something from Cigna that said your normal cost for this test would have been $350. It's $50, and then you total up, the cost of that through insurance. My copay was like $450.
Right.
And we're offering it for much less. So even the copay, and I always think
we're less than copay.
Right. Yeah. How does Cigna, which is this multi-billion-dollar company, have worse rates?
It's the medical system we live in. It's the politics.
Yeah.
And when you start getting these deals, you wonder, well, what do these labs really cost? If they're charging $5,000 for a panel, and like we're able to go straight to Quest and purchase them for $350, like, and I give the patient the same price.
Exactly.
We don't upcharge, And it's like, what do they really cost? 2 pennies.
I know.
So they're making so much money anyway.
So listen, everybody, like, share, subscribe this video if you liked it. I'm Rewind Miami, Rewind Anti-Aging in Miami. So follow us on Facebook. And my buddy Mike, give your own plug.
Age Management Institute of Santa Barbara, AMISantaBarbara.com.
Is that your Insta? What's your Insta?
At AMI Santa Barbara.
There you go. Look him up. Follow him. We both have really good content, social media. So like, follow, and share this video.